Today we're going to do an assessment of the neck, chest cavity, heart, and lungs. I've already washed my hands, put on clean gloves, explained the procedure to the patient. Normally I'd have a patient in a gown or without a shirt, but for privacy we're going to leave it on. I have him sitting up straight, hands in his lap, and ankles uncrossed. So the first thing I'm going to do is I'm just going to look at my patient. He is alert, doesn't appear to be in any distress, and is breathing at a normal rate, about 14 times a minute. His skin color is pink, no cyanosis or clubbing to indicate poor oxygenation. Rise and fall of the chest is symmetrical and regular. No audible wheezing or other noises. No intercostal or diaphragmatic retractions during inspiration. And the spine is midline. No curvature. It also has a downward sloping of the ribs. The carotid pulse is slightly visible bilaterally, and it's palpable bilaterally and smooth. The apical pulse is found at the 5th intercostal space at the midclavicular line. Slightly palpable. Patient's negative for any heaves or thrills. Okay. Take a deep breath for me. Okay. The chest cage rises and falls symmetrically. We're going to do some tactile fremitus. Every time I move my hands, just say 99 for me, starting now.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. We have resonance over all lung fields. Now I'm going to percuss. Okay. Got resonance in the upper lobes and some dullness over the lower lobes, which is consistent with normal findings. Now I'm going to listen to his breath sounds. Just breathe normally. Take a deep breath. Deep breath. Deep breath. Last one. Alright, you can breathe normally. Right. And all lung fields are clear and equal. No evidence of wheezes, rhonchi, or crackles. Now I'm going to listen to the heart tones. Good S1, S2 heart sounds, no murmurs or irregular beats. Apical rate of 78. Normal sinus rhythm. Okay, now I'm going to use my bell and tell you what I'm listening for. The second intercostal space on the right sternal border, I'm listening for the aortic valve. On the second intercostal space on the left sternal border, I'm listening for the pulmonic valve. The third intercostal space on the left sternal border is Erb's point, or the left atrial area. The fourth and fifth intercostal spaces on the left sternal border is the tricuspid valve area. In the fifth intercostal space along the midclavicular line is the mitral valve area. All heart tones are normal and expected. Overall, my assessment is consistent with normal findings, and I'd recommend a follow-up during the next routine physical to trend any changes in condition.